I think the thing I have found most compelling is that we see the medical outcomes when we have loss as humans. So the epidemiological findings that a man is almost twice as likely to die of a heart attack in the
Mm.
first 3 months after his wife dies compared to a married man is a stunning medical
It really is.
statistic,
It really
right?
is. This idea of dying of a broken heart and the
Mhm.
stress that comes along with that. And that's not really just a catchphrase, as you
No.
mentioned. There's some real data behind all this.
Yeah.
What does it mean to die of a broken heart?
So we know that this is a replicated fact that we see increased mortality after the death of a loved one. We also have a study that says on the day a loved one dies, you are 21 times more likely to have a heart attack than any other day of your
Holy cow.
life.
Okay.
Isn't
Wow.
that crazy?
It is. Well, you also pull out other things, even such as high blood pressure that comes out of
Yeah.
such things, right?
hmm It turns out, and this is a fascinating finding as well, we see increased all cause morbidity and mortality. So, what that means is that morbidity is getting a diagnosis of some medical illness. And of course, we know what mortality is.
Yep.
But all cause means that we see increased risk for all types of illness, from pneumonia to COPD to colon cancer
Mm.
to pneumonia. So the thing that's important is thinking about, well, what mechanisms could account for that, right? We think of the organ systems as all having different processes. How could something like the death of a loved one be affecting all of those systems? And I think in my own research, what I've seen is when we start to think about the idea that our endocrine system, our hormones, like stress hormones like cortisol, and our immune system, things like inflammation, that if those are increased in bereavement, which we see in the data, then that's going to affect every organ, right? So inflammation is going to make your joints
Right.
hurt more if you have rheumatoid arthritis, and it's going to make it harder to breathe if you have asthma. They're both inflammation, but they can be affecting all these different systems, which is what we see in the data. The fact that we know that this data has been around for so long, the real trouble I see is, why are we not trying to do anything when we
Mm.
know there's a medical risk? Usually we're creating ways to buffer that risk or to assess the risk and intervene if needed. So knowing this data has actually been around for a long time, that's my question. This is an analogy which I don't know if you'll appreciate, but I sometimes think of pregnancy and bereavement as having some similarities. And
Mm.
what I mean by that is that pregnancy is a totally natural, normal process, right? Pregnancy is not a disease.
Right.
It's still a very physiological event. And what we've done as a society is, because we recognize that it's also a heightened time for medical risk, is that we have supports in
Yes.
place,
Right.
right? Prenatal care, where we
Absolutely.
provide education for people about what the experience should be like. And then we have opportunities for them to check in so that we can see if they're having, gestational diabetes or hypertension, and provide appropriate medical responses in those instances. So I think there's ways to think about whether our healthcare could consider bereavement in a similar way. This is a risky time for people. Most
Hmm.
people will do fine, but we need to have both education, literacy, and also a way for them to check in and see if they're doing okay and follow up.
You're talking about the studying of this in an educational setting.
Mhm.
Are medical professionals trained in the idea in a way that you think is sufficient to understand grieving and bereavement and the not only the impact on the body, but ways to help people work through it?
Unfortunately, none of our helping professions are receiving the type of training in grief and grieving that is most current in our
Okay.
scientific understanding, and frankly, often none at all. So I really would love to see that. I trained as a psychologist, clinical psychologist, great graduate program I went to, had exactly zero lectures on grief.
Okay.
And that is true for psychiatry. That is true for medical doctors. They
Why do
will
you think
have,
that is?
well, it's interesting. So there's been a real taboo. about talking about grief, in
Hmm.
part because it leads to talking about death. And death is not something that our medical professionals like to talk about, as you
Okay.
might imagine.
Yep.
But in addition, I think there is a misunderstanding. We need to get the word out, so to speak. Most people think about Elizabeth Kubler-Ross's Five Stages
Yep.
of Grief,
Yep.
which came out in 1969. Think how far science has come and medical training since 1969. Our curriculum is not updated to
Hmm.
include much of what we know now about how to address grief and grieving. And so, those five stages are not something that we think of as happening in a prescribed order, and certainly not coming to a closure where grief ends. Those have not been borne out in longitudinal studies. And I think it's important, to improve grief literacy among all the helping professions would really advance our ability to support grieving people.